Hi there, welcome to Empowered PT with Dr. E. Today we're going to discuss the topic of heat versus cold. And this is one of those questions that I consistently get from my clients on a daily basis. So while there are no clear-cut guidelines on when you should use ice versus heat, I'm going to share with you some tips that will hopefully provide you with some more guidance on when ice is more appropriate and when heat might be more appropriate, and when combining the two can also be very useful. So one of the guidelines that we all hear is usually within the first 72 hours of an injury, you always want to utilize ice. And the reason for that is because in the acute phase of an injury, there tends to be more inflammation and swelling. And so what the ice does is it closes down the blood vessels and causes vasoconstriction. And that vasoconstriction will help to decrease the swelling and the inflammation. So in the acute stage of an injury, you always want to use ice. And when you're using the ice, you want to make sure that you're not putting ice directly on your skin, that you have a pillowcase or a light piece of fabric between the ice pack and the area that you're icing. You also want to make sure that you are not icing the area for more than 20 minutes at a time. If you keep the ice on for too long, it can actually reverse the effects of the ice and cause vasodilation, which is opening up the blood vessels, and actually cause more swelling. So when you're utilizing ice in the acute phase of an injury, you want to put it on for no more than 20 minutes. Make sure it's not directly on the skin, but it's cold enough that you can still feel it. And you can ice multiple times a day, making sure that you're giving your skin a break for several hours between the icing. Even though we know that the ice is ideal in the acute phase, there are many times that I am still recommending ice to my patients in the chronic stages of pain. So the way that I like to describe it is, if your pain is the dominant feature, so if you have more pain versus stiffness, I tend to guide my patients to utilize ice. If you have more stiffness and tightness in the muscles and it's an injury that is more in the chronic stages, it's been going on a few months, then I tend to encourage patients to use heat. So often it might look like a patient has osteoarthritis, let's say, of their knee, and they wake up and it's stiffness, but it's still pain, but they want to do an activity. They want to go to aerobics or go take a walk. So I will often advise my patients to put the heating pad on your knee for 15 to 20 minutes, get it loosened up, get that blood flowing, and then go and do your activity. And if you feel any soreness after the activity, then you can follow with the application of ice for 15 to 20 minutes. And that tends to be a really nice way to complement both the vasoconstriction, the turning, closing down the blood vessels, and then opening them back up. So alternating between heat and ice in the chronic stages of an injury can also be very helpful. There has been literature recently that has shown that for people who are suffering from delayed onset muscle soreness after an intense workout, that taking a warm bath within 24 hours really helps to negate some of that muscle soreness. And when that delayed onset muscle soreness persists for 72 hours, then they actually recommend cryotherapy, taking a cold bath. So there, unfortunately, are no hard and fast rules on ice versus heat. Except for the acute phase, you always utilize ice. In the chronic stages, if it feels more muscular in nature and tightness, then you want to utilize heat and possibly the combination of the two. The times that you want to avoid ice are if you have an extreme sensitivity to the cold. And I don't mean that you prefer nice weather. I mean that you have Raynaud's phenomenon or a condition that makes you hypersensitive to the cold. Or an open wound, you don't want to use ice. And the same goes with heat. If it is an acute condition, there's redness, there's swelling in the area, do not apply heat, or any open wound. You want to avoid heat as well. But listen to your body, right? Your body is going to tell you what feels better, and not just what feels better in the moment, but see how you feel 30 minutes after icing or 30 minutes after utilizing heat, because often the heat might feel very good in the moment, but 30 minutes later, you might notice that your symptoms are actually flared up again. So listen to those signals that your body is sending you, and also allow that to be your guide. I hope that some of the guidelines I gave you will help to better guide you in your assessment of what feels best for your body, and determining if this is an acute injury, if it is a chronic injury, and is it more muscular and stiffness, or is it a deep throbbing, in which case ice would probably help your symptoms more. I hope you enjoyed today's video, and thank you so much for joining me. And don't forget to subscribe and share this channel with your friends and family. I hope you have a wonderful day, and I look forward to seeing you on the next video. Take care. Bye-bye.